Good morning, everyone, and apologies for the little delay. Welcome to this press conference following the publication of the new risk assessment by the European Centre on Disease Prevention and Control. Today we have with us Commissioner Kyriakides and the Director of the ECDC, Mrs. Ammon. I will first give the floor to the Commissioner and to the Director to make some introductory comments, and then, as usual, I'll open the floor for all questions that you may have. Commissioner, the floor is yours. Thank you.
Thank you, and good morning, everyone. COVID-19 is the public health crisis, of course, we have all feared. It has turned upside down the way we live our lives, how we interact with each other, how we are when we are in social spaces, the way we work. I would say that no part of our lives has remained unaffected. The disruptive but necessary restrictions placed by most member states during the spring did manage to slow down the spread of the virus and allowed us to slowly but gradually start to get back to what we have often said will be our new normal. However, the much expected and I would say needed lifting of some of the restrictions during the early summer has led to what we have continuously cautioned against, an increase in cases. As you will hear from our Director, Andrea, Ammon, in some member states, the situation is now even worse than during the peak in March. This is a real cause for concern. What this means, to be very clear, is that the control measures taken have simply not been effective enough or not being enforced or followed as they should have been. This is clearly underlined in the updated risk assessment to be presented today by ECDC. While people testing positive for COVID-19 are younger in several member states and mortality rates remain lower than before, we are starting to see an increase in the occupancy of ICU. We cannot lower our guard. This crisis is not behind us. Moreover, autumn and winter are the time of the year for more respiratory illnesses, including seasonal influenza. To prevent what could potentially be a lethal twindemic of COVID-19 and the flu, which could overburden our health systems and lead to more loss of life, we need to increase the coverage of vaccination rates. Today, against what frankly is a very worrying background, I see an absolute necessity to send a strong and clear message to member states that our recommendations on short-term preparedness that we issued in July are more valid than ever. From stepped-up testing to closer contact tracing, from improved public health surveillance to better access to personal protective equipment and medicines, and ensuring sufficient healthcare capacity in ICU units, all member states need to roll out measures immediately and at the right time, at the very first sign of potential new outbreaks. Of course, I will say it is encouraging to see that progress has been made, notably on the agreement of a common EU approach to testing, and I urge all member states to follow this. We still see, and we are hearing now, from several member states how they are moving across with implementing the urgent actions we presented in July. But hearing that today we are okay is not enough. Are we planning for the worst-case scenarios? We have put in place tools in the EU to support this effort, as was required and asked of us. Joint procurements for supplies for intensive care units and treatments are there to be used and plan ahead. We have delivered the first batches of the only authorised COVID-19 treatment, remdesivir, purchased under the EU Emergency Support Instrument, and are already in negotiations for the next joint procurement for this. We are negotiating with pharmaceutical companies for COVID-19 vaccines. As many of you know, have concluded 2 contracts so far to ensure access to such vaccines once proven safe and effective. Finally, we are working with Member States and we will insist on a coordinated approach on free movement restrictions to ensure more clarity and predictability for citizens. We have already presented this proposal, but we have not yet achieved Member State consensus on this, and I urge Member States to move ahead. It is extremely important. But with the COVID-19 vaccine being months away, I'm deeply concerned by what we are seeing now and what may follow in the coming weeks and months. We all need to understand that finding a vaccine will not be a silver bullet. Citizens, we all are the first line of defence against COVID-19, and our self-discipline to adhere to measures will determine the next months. We must prevent a situation where governments feel they have no choice but to impose generalised lockdowns. This will be detrimental to our mental health, detrimental to our economies, detrimental to the well-being and the education of our children, detrimental to our working and daily lives. We have to take measures that will protect those around us, whether they are parents or grandparents or those vulnerable in our societies. To support Member States, we have also today, with ECDC, issued guidance on non-pharmaceutical interventions. Andrea will be speaking about this immediately after myself. These are the most effective public health interventions against COVID-19 that we have today. We are, in some places, and I understand, witnessing a real COVID-19 fatigue, with physical distancing and an apparent disregard of the norms, and even we're seeing protests in some Member States. This needs to be addressed by Member States, and we need to find ways to deal with it. I urge Member States to reach out to young people, to make them understand the situation that we are all up against. We need to do everything possible to fight misinformation and fake news, which is creating even more confusion in citizens. And Andrea will be able to speak a little bit about what we're seeing now in the new cases of COVID-19 in relation to the age demographics. Here, I would call on Member States to be consistent and coherent in their communication and ensure as much predictability as possible to allow citizens and businesses to remain and have a sense of control. I am convinced that predictability and clear communication to citizens and coordination with other Member States will increase compliance and protective measures. I have already stressed, and I cannot stress strongly enough, that we are responsible for each other. We must all, regardless of age, regardless of vulnerability, continue to keep physical distancing, wear face masks, take care of hand hygiene. Try to meet the person only within our social bubble of relatives and stay home when we feel sick. Ladies and gentlemen, we are at a decisive moment. Today we're here to call on everyone to act decisively too. It might be our last chance to prevent a repeat of last spring. I will now immediately pass the floor over to Stefan and to Andrea, and Andrea will present the details of the later ECDC assessment published today, as well as the guidance on non-pharmaceutical measures. Thank you.
Thank you, Commissioner. I now give the floor to Director Ammon. Director, please, go ahead.
Yeah, thank you very much, and good morning to everybody. I'm happy to present the key messages from the two documents that we have published today. As mentioned by the Commissioner, we are seeing an increase of cases in the across the EU countries. And apart from the increased testing that contributes to the increase, we are seeing in several countries a progress from local transmission to more sustained community transmission. As mentioned, the large number of the cases right now are among younger people, which comprises the age group between 15 and 49. And although this age group has a lower probability for severe cases occur in this age group. So among the cases reported to us in the past 4 weeks, 44% of the severe cases were among this age group. And what the other concern is from our side is that this increasing transmission in this age group may also go over to the more vulnerable older age groups in our population. In our risk assessment, we have grouped or the risk that we assessed. For this risk assessment, we have grouped the countries in 3 groups. So there is one group of countries with stable trends that include a lower proportion of elderly cases among elderly, lower proportion among of severe cases, and a low proportion of death notifications. And for this group, the risk is considered low. For this group of countries or areas in countries, because I haven't mentioned that although we are talking about an increase, it's very different situation for the different countries and even in some countries within the country. So the second group that we are looking at is cases with countries with concerning trends, and here these countries are characterized by high and increasing notification rates reported due to increased testing. And the transmission is still primarily among younger age groups with a low proportion of severe cases and low death notification rates. And here the risk is moderate. The last group is countries with trends of high concern. And these are countries where we see increasing notification in older cases, increased proportion of hospitalized and severe cases, probably due to this higher notification in older cases. And we're also seeing in these countries increasing or already high death notification cases. And here the risk is high. And for the vulnerable individuals in all these countries, the risk is very high anyway. So what can be done? In principle, we have to control the transmission among older children and adults younger than 50 years of age, and I can go in more details afterwards. We have to ensure that those that are socially and medically vulnerable are protected, and we have to protect our healthcare workers. So these are the 3 things, the 3 objectives that need now to be implemented. As the Commissioner has mentioned, we have published, together with the risk assessment, also a document on non-pharmaceutical interventions. And the reason is, as already also mentioned by the Commissioner, that in the absence of a vaccine, this is basically the only tool that we have. In this document, there's nothing new, so we haven't come up with any new measures. However, we have put together all the evidence and the knowledge that has been gained over the past month, where these measures, for the first time actually, have been applied in a large context. We have put this together, and the idea is that countries, due to the different epidemiological situation in the countries, can now go and have a look what will work best in their specific context. Now, while these measures may have a certain variation, depending on the epidemiological analysis in a country, there are certain measures that have to be in place everywhere all the time. And that is sufficient testing capacity, rigorous contact tracing, and a good quarantine for contacts, and a good risk communication. And this risk communication has to be tailored to different parts of the population in different ways. So we have, on the one hand, the general population that needs to be made aware why these measures still have to be in place for physical distancing, wearing a face mask if this cannot, the distance cannot be kept, and staying at home when having symptoms, and proper hand hygiene. And that their contribution is really essential in order to control the pandemic. But then there has to be a communication addressed to the vulnerable population. Because they also have to give them the means how to protect themselves. And the last group that needs to be addressed separately are the younger ones. Because some behavioral studies that have been carried out make it very clear they feel themselves invulnerable and have no concerns that they could actually transmit any disease or the virus. So these risk communication efforts have to be really stepped up to ensure the compliance to the measures that countries have to put up. I close it here because I would like to leave enough room and time for your questions. Thank you.
Indeed, going to open the floor for your questions. I see that several of you have raised their hands. The first question goes to David Carretta. Please go ahead.
Thank you very much. David Carretta, Radio Radicale, Italian radio. Commissioner, we are seeing countries going in different directions. Belgium is leaving some social distancing measures, even if the number of people tested positive is increasing. On the other side of the border, France is imposing new restrictions. What is the model that you are promoting? Is it feasible to have countries going in different directions with different strategies in front of this second wave? Thank you.
David.
Yes, I'll pick this up and then also ask Andrea to comment on this. I'll just say that we have been very clear on the model that we have been asking member states to follow from our preparation communication on the 15th of July. We were very clear that what needs to be done in terms of member states is the level of preparedness to include, as Andrea has said, testing, contact tracing, social distancing. It is also understandable that different countries are at different stages of the epidemiological curve, and of course within countries you see differences. So we would expect this, but what we do expect is that member states have in place what they need to do in order to be prepared, so when they have cases they'll immediately be able to take measures. And if Andrea would like to comment on this.
Director Ammon, maybe you would like to add something?
Yes, thank you. As I said, at this stage, with such a diverse picture across Europe, it's not possible to say everybody has to do the same. But everybody has to monitor what's happening, and this is why we're also saying that robust surveillance that allows for timely recognition of any changes, be it in one age group or overall, be it in one part of the country or overall, has to be in place to support the tailoring of the measures. But at this stage, there is no way that with these different situations in the countries, we can say everybody has to do the same, except for those measures that I have highlighted that should be in place everywhere. Thank you.
Thank you, Director. The next question goes to Angelo Di Mambro. Angelo, the floor is yours.
Hello, can you hear me?
We hear you loud and clear.
Thanks. The German presidency, it's not so long ago, has published a document in which it's clear that the discussion on things like a joint risk assessment and possible common measures, I quote the document, seem particularly sensitive, the discussion among member states. What is your comment on that? Are we so far from having a common approach to the interpretation of the data and then on the actions to be undertaken? Thanks.
I believe we've come a long way in terms of the coordination, what we need from member states. And we have put forward a number of recommendations, including a recent one on testing strategies, and member states and through the Health Security Committee have adopted these. So, as Andrea said, what we are seeing is different situations evolve in different member states. What I would like to send as a message today is that all member states need to have certain things in place, and then from then on, the measures that they take at times will depend on their local situations. So I think that we have a better level of coordination, definitely through the recommendations. But I would say that there are areas where we need to highlight and improve our overall framework.
Thank you.
And sorry, if I may also add, for this reason, we're also having the lessons learned package coming out in November.
Thank you, Commissioner. And then I see nous avons Sophie Petitjean. Sophie, la parole est à toi. You need to push the legendary speak button. Yeah.
Yes, can you hear me? Sorry. I will ask my question in French, if I may. Donc merci pour cette conférence de presse. J'ai deux questions. La première, elle concerne la quarantaine, surtout la durée de la quarantaine. Donc récemment, après une informelle en Allemagne, il semblait y avoir consensus pour ne pas descendre en dessous de 10 jours. Or, on voit que certains pays vont dans suivent des directions différentes. Je vois que le CDC a recommandé ici 14 jours, voire 10 jours si le test est négatif. Est-ce que vous pourriez vous exprimer là-dessus? Est-ce qu'il y a vraiment une ligne claire de la part de l'ECDC et de la Commission par rapport à ces exemples qui divergent? Et alors, ma deuxième question, elle s'adresse à Madame Kyriakides. On sent ici un ton légèrement différent, plus inquiet. Est-ce que mon interprétation est correcte? Vous dites ici c'est la dernière chance, je suis vraiment très inquiète. Est-ce qu'il y a quelque chose qui change et qui vous fait dire ça? Et juste sur le Q&A que vous avez publié, vous parlez des contrats. Vous dites qu'il y a une différence au niveau de la participation des États membres. Pardon, c'est une troisième question, mais elle est vraiment toute petite. Il y a une participation obligatoire ou volontaire des États membres. Je voulais savoir si dans les deux contrats qui ont été signés avec Astra et avec Sanofi, est-ce qu'il s'agit d'une participation obligatoire ou volontaire? Merci, désolée.
Merci beaucoup, Sophie. Je vais peut-être d'abord passer la parole à la directrice Ammon pour la première question concernant les quarantaines.
Thank you. Yeah, the duration of quarantine is under debate right now, in particular because it is by some countries combined with with tests, and we are currently looking into what the impact would be in coming to a general recommendation. What we would say. Currently, as we haven't concluded this considerations and deliberations, we still have adherence to the 14 days.
Thank you very much. For the second and third question, I will pass it for the Commissioner. Commissioner, question number 2 was, is this the last chance we're talking about? And second, what about the obligatory participation in vaccine contracts concluded with vaccine developers?
I think the first question, well, the second question, but the first to me, was exactly the reason that we are standing here today. Yes, we are concerned. And that is why we're here with Andrea to share this concern and to really highlight the importance that we need to ensure that these messages of where we are with the COVID-19 are really get through to everyone. And I want to say something. You said, why now? My question for me is I think you can answer it, is we're seeing an increase in the number of new cases in so many member states. So this is a time when we need to make sure and ensure that we have mobilized all the resources that we have raised since the July communication to make sure that we are able to cope with this number. And I would repeat that, yes, I have no reason to hide the fact that we are concerned, and I'm concerned with the situation as it stands now. The second question, I think, had to do with the vaccines, if I understood. Yes, we said we have concluded and signed 2 agreements, the one with AstraZeneca and the other one with Sanofi GSK. These are agreements and contracts that have been signed following negotiations in which the Commission is in the process with all 27 member states. So all 27 member states are part of this negotiation process. And are part of the agreements once they are signed. Thank you.
Thank you, Commissioner. We had a question from Thomas Miglerina. Thomas.
Trying to click the speak. Okay, yes. I have a specific question on the cooperation with Switzerland, and I would like both the technician and the politician's assessment. Switzerland is in the middle of Europe. It's important. The situation is not good. At the same time, we know that we miss an agreement of cooperation. So, for example, there will be no interoperability of the app. There is an emergency participation to the ECDC exchange for information that was granted given the situation. So I would like your assessment and how complicated it is for the European Union, for the European side, to have this this grey hole in all the ECDC maps. Thank you.
I'll take the first part and let Andrea answer the second. I'd just like to let you know that we have extended our cooperation with Switzerland in the Health Security Committee and correctly in our information exchange system. So we fully agree that we need to cooperate. We're in a pandemic. Virus has no borders, and we're doing everything possible to be as inclusive and, of course, exchange information as effectively as possible with all. Thank you.
Director, you would like to add something?
Yes. Yes, thank you. I just want to say that the level of cooperation that ECDC can have with countries depends on the EU-level decision what kind of cooperation between the EU and this country is happening, and that is independent of the fact that for this cooperation for this pandemic we have to work together globally. But for specific things like you mentioned the map, this depends on the cooperation level that is agreed between the EU and the country, and we have to abide by that.
Thank you. The next question is for Odile. Odile, c'est à toi.
Oui, bonjour, merci. En français, si c'est possible. Hier, au Parlement européen s'est tenue la commission des transports et du tourisme. et nous avons entendu des cris d'appel au secours des professionnels de ce secteur. Certains ont même dit si nous ne mourrons pas du virus, nous allons peut-être mourir de faim. Et donc vis-à-vis de ce secteur qui semble souffrir particulièrement justement des quarantaines qui sont annoncées avec 48 heures de préavis par exemple, qu'est-ce que vous pouvez faire pour essayer de leur donner encore un peu de courage pour continuer? Quand vous prenez le cas du trafic transmanche, des ferries transmanche, du Brittany Ferries par exemple, qui a perdu 65 000 annulations dues à la quarantaine annoncée 48 heures précédemment par le Royaume-Uni, qui jusqu'à la fin de cette année est encore en période de transition. Merci.
Merci beaucoup, Odile. Je vais d'abord passer la parole à Ammon.
Shall I pick it up?
Okay, while we're waiting for the Peace Commission.
I'll pick this up. Yes, I understand the concerns, and I'd remind ourselves that in the summer we came out with a tourism and travel package because we understood that we needed to have as much coordination as possible. And we're doing everything possible to coordinate and be able to allow free movement to continue as fluently as fluidly as possible in a pandemic. We have put a proposal on the table, a proposal on a coordinated approach to free movement restrictions. I believe, and we believe, that this will create more clarity and predictability for citizens and for businesses. Member States are discussing it, but as I have said in my opening remarks, they need to deliver results faster, and I urge them to deliver results faster. And Andrea may have.
Yes, thank you. Ms. Ammon, if you have something to add from the ECDC perspective, please.
Yeah, only that, I mean, we have been working together with our colleagues, sister agencies that work in the transport sector, with the Aviation Safety Agency, the Railway Agency, and also the Maritime Safety Agency, to come up with protocols for the case that travel on these respective transportation devices is done. That is how far we can go, and we are working with the Council in helping to reach a consensus on common travel measures.
Thank you. Gillian Deutsch, the floor is yours now. Gillian, go ahead.
Hi, thanks so much, Commissioner Kyriakides and Dr. Ammon, for being here today. I have a few questions, if you allow me. First, obviously back to these harmonized border measures and quarantine rules. Governments have been talking for quite some time and still have not come to an agreement. I was wondering what's taking so long, and even if governments do agree to some harmonized rules, if Commissioner Kyriakides, if you believe that they will actually be implemented in the end. My next question is for Dr. Ammon. We're seeing high transmission in younger people. I was wondering then what governments should do now to ensure we don't go back to full lockdowns. Are we talking, governments should shut bars down? Should they shut schools down? Do we need these circuit breakers? Curious if you can give us kind of a nutshell of what governments can do. And last, very quickly, I was also curious about, we're nervous that COVID will coincide with the flu. I'm curious then if we have any updates on harmonized vaccine plans between EU countries. Vaccination plans, excuse me.
Yes. You're referring to the vaccination plans for the seasonal flu, right? Yes, I'll take that as a yes. Maybe.
Yes, thank you. I'll take the
first two
questions. Thank you, Gillian, for those questions. First of all, what is taking member states so long for the harmonized rules? We put forward the harmonized rules for travel because we believe that this is necessary. And this is why I urge today to move more quickly on this. So I don't have anything else to add to that. Will they be implemented? Well, I think that it is extremely important that we implement everything that we agree on across the board when you're dealing with a pandemic. So I would hope that once they are agreed on, and I urge again that these are agreed on as soon as possible, then they will be implemented effectively. On the question, I think one question was to Andrea, but if I may take up my question, which was on the flu vaccine. This has been a concern for us from the summer months, and we came out with this in our July communication as well. This twindemic of possibility of the combination of the flu with COVID-19, the Health Security Committee has already discussed and agreed on a common strategy. Of course, vaccination policies, you know, are a national prerogatives, but I believe that by discussing it as we have in the Health Security Committee and putting forward our recommendations, we are able to encourage them to all work in the same direction. Thank you.
And then we still had a question on younger people, and I think that question is for Director Ammon.
Yes, thank you. What can be done now is really target certain measures towards this younger age group, and since the increased transmission happened somewhere, what countries should do now is identify those settings that where in particular younger people meet, and that might be different settings in different countries. The next step would be to consider whether these settings have to be closed or whether it's possible to restrict access, like a certain percentage or number of people, so that proper physical distancing can be adhered to. But then also that has to be accompanied by really a proper risk communication to younger people, because as I said before, they are aware that the virus exists, but they don't feel that it's a concern for them. And I think that has to be conveyed, that also younger people can have severe disease, and they can also transmit it to people that have a higher likelihood of actually having a severe course. I just wanted to say regarding the influenza, we have always said that the influenza vaccination for the target groups should be intensified this year, so that the level of coverage among elderly people and also healthcare workers and people with underlying disease is higher than in the past years. We are working with WHO and the member states on protocols how to do surveillance for influenza and COVID in the winter in parallel, to be able to keep track of both of the diseases. Thank you.
If I may, for young people, I think it's important that we understand that we're not here to blame young people, but young people often receive communication messages in different ways. And what we are saying is that and ECDC and Andrea has stressed, is we have seen a change in the numbers, in the ages. So member states need to address this specifically with communication strategies which are going to be young people friendly, so the messages really get across. It's important that we really see this, and this is why we give these risk assessments, because breaking them down, then it allows member states to see where they should be addressing their communication, but also their strategies. Thank you.
Thank you very much. And we have our next question coming from Mose. I see. I'm sorry, a little confusion here. No, I see Verena. Verena, please, you have the floor.
I hope you can hear me now. Hello?
We hear you.
Super. I'm Verena Schmidt-Roschmann with the German press agency DPA. I was wondering if you could elaborate a little bit more on the measures to be taken now, because on the one hand you say the measures taken have not been effective. even though testing and tracing has been stepped up in many member states, and masks are much more common, and people are getting used to wearing them. So my question is, are the measures at our disposal effective at all? Could you mention some that could be more effective? And in final consequence, could a second lockdown be avoided at all? Thank you.
Thank you very much, Verena. I will pass the floor to Dr. Ammon. Go ahead, Doctor.
Mm-hmm. Yeah, thank you. Coming to your last point, I think all what we're doing right now and why we're raising now the alarm is to avoid exactly that we have to go into a situation of intensity of measures as we had in spring. In our document on the non-pharmaceutical interventions, we have at the end a table where we have listed all the measures and also from our side the recommendation when they should be implemented with an assessment of the impact, the social and economic impact. So what we know from the effectiveness is that when they're implemented as a package, as we did in spring, they have an effect. What we are less sure is what the single measures, what their effectiveness is. And that is something why I highlighted before that when a measure is implemented, it needs to be really under a good scrutiny with surveillance to see whether it has an effect or not. If, for instance, the effectiveness is hampered by adherence or compliance, then countries may have to think about whether enforcement measures should be taken. And some countries actually are doing this. So there are maybe some elements that countries can add compared to what is doing right now. And also regarding the face masks, the use in the countries is quite had quite a variation, when we compare measures from June and September, there are also now fewer countries that have measures implemented.
Thank you, Doctor. I will now give the floor to Maria Psara. Sorry, Maria, you're supposed to have the floor earlier, but please go ahead.
Can you hear me now? Hello from my part. One political question, I suppose. It is obvious that nobody wants a new lockdown. It's true. But on contrary, in countries like Belgium, for example, although the number of the cases raises, we see that the measures are easing. So the question is, are the member states in contact with the Commission and with ECDC? I suppose yes. So do you have the impression that the member states follow your guidelines, listen to you, listen to what you say and your concerns? And if not, what can the Commission do for that? Thank you very much.
Thank you very much for the question. Dr. Ammon, are we following your advice?
I think to a certain degree. If you want to have a short answer. But I have to highlight that the responsibility for the measures taken really lies with the countries. And in some countries, it's not even the national level that has the responsibility, but some regional or even local level. So there is what we can do is say what is the range of measures that can be taken, what is the evidence that they can work, and what would be a potential impact of these measures. But in the end, the member states are responsible for taking the measures and also accountable for the result.
If I may comment here as well, and just add to what Andrea said, and I'll come back to, I think it was also Gillian made this point. Member states, we have a coordination, we have a good level of communication. They're working with ECDC and through the Health Security Committee, and measures are being put into place. But measures being put into place, the question that comes immediately is, how are they implemented? And this is something that we need to address. Whether they're put into place, are we then overseeing their implementation so that they're getting maximum effectiveness? So this is one question. And the second question is, in terms of communication, is I think that we all need to understand that we as citizens are the first line of defense in a pandemic. So implementation of measures is also a responsibility that we have on an individual level, but also the enforcement and the implementation of measures is something which is the political level is with member states. Thank you.
Thank you. And I will now pass the floor to Mose. Mose, go ahead.
Yes, thank you very much, Stefan. Yes, I would like to ask a brief question to Director Ammon. You talked about, let's say, the trends, statistics, and the risk assessments, and the increase in notification of new cases. And that could, as you said, also depend on the increase of tests. My question is there a crucial parameter in the form of the percentage of persons tested positive? Is that something which is a parameter which is the same for all countries, so that it depends on the, let's say, national circumstances? In some countries it has increased to more than, let's say, 10%, at least in the first wave. So my question is, how should we interpret it, this parameter? And do you see an increasing trend also in this parameter? Thank you.
Thank you. Director Ammon.
Yes, thank you for the question. Indeed, the figure to look at the notification figures and the trend alone is not sufficient, because this depends on not only how many tests are done, but also who is tested. And as said many times, there are different strategies and approaches in the countries that we tried to, since early on, to really standardize this approach. Now, when we look at the numbers of tests carried out per 100,000 inhabitants, there's a wide variation in the countries. It ranges from a few hundred to several thousand tests per 100,000 inhabitants. And in our risk assessment, you find, when you go there on page 3, really a curve that shows how the tests in the countries went up. They are still increasing, so countries are still increasing the capacity. And then a second curve, in the same graph, that shows the percentage of these tests being positive. And we're looking at both of these parameters together, because if you increase the tests, and you have increasing numbers, but the percentage of the tests that are positive remains low, that means that the increase is due to the increase in testing. So the increase on cases is then due to the increase in testing. Whereas what you can see now from August starting is an increase in the percentage of positive tests. And that is for us the alarming part, well, because now we see that the rate of positive tests is increasing, which means that there is increasing transmission. So that is the connection between the case notifications, the number of number of tests per 100,000, and the percentage that is positive. That has to be looked at it together. Thank you.
Thank you. I have to take into account that soon our midday briefing starts, so I will not be able to take all questions, but I now give the floor to Samuel. Samuel, go ahead.
Oui, bonjour, Samuel Petrequin pour l'agence Associated Press. Ma première question, c'est sur le vaccin, parce que ce matin, la ministre de la Santé belge a annoncé que le vaccin Sanofi serait prêt a priori en mars, et à distribuer ensuite à tous les États membres à ce moment-là. Est-ce que vous pouvez confirmer cette date? Et ensuite, j'ai une question plus générale sur les mesures précaution et sur les mesures les plus dures qui ont été prises dans certains pays ces derniers temps, pas forcément en retour de lockdown, mais par exemple la fermeture des lieux de vie comme les bars, les restaurants, à Marseille récemment, là, total. Est-ce que toutes ces mesures ne sont pas parfois de nature à être contre-productives et à décourager les gens? Et ma question, c'est est-ce qu'il ne faudrait pas mieux insister sur les mesures de base? Et dernière question, c'est sur l'immunité collective. Est-ce qu'on en a fini avec ce concept? Est-ce que en fait la hausse des cas de contamination, tant qu'il n'y a pas de surcharge dans les hôpitaux, n'est pas une bonne chose?
Merci beaucoup.
I'll take the first question and then Andrea will answer. Thank you for that question. In terms of the Sanofi vaccine, first of all, I will say that we know that a safe and effective vaccine is going to be the surest way of exit from the COVID-19 pandemic, and this is why the European Commission has the vaccine strategy, and we're working with and for the member states in order to ensure a broad portfolio which will help us and have a safe and effective vaccine when this is available for all. In terms of predictions, I'm not able to make a prediction. We have seen how in clinical trials, phase 3, you can face many uncertainties. So I would not go as far as putting any predictions in terms of timelines. We're following all very closely together with, of course, the European Medicines Agency, and we await to see the results. Thank you.
Thank you. Dr. Ammon, perhaps on the mesures de précaution and collective immunity?
Yes, regarding the measures, it's very clear that closures of shops and venues has a societal impact. The basic measure that has to be taken is keep a physical distance. And put on a mask if you can't, and hand hygiene. Now, taking these more drastic measures of closure of shops and venues, bars, restaurants, depends on how well it's possible to ensure these basic measures in these venues. So if it's possible to have distancing in a restaurant or in a bar, then I think it's a different consideration to close or not than if it's such a small place that only one person can or a few persons can be in there anyway. So I think it's very difficult to give a generalized advice here, but the basic measure is if you are able to keep distance, then that's the safest thing. Now, regarding the herd immunity, this is something that is under constant observation. From the data that we have until today, the level of people with antibodies is still not very high. So in most places, it's maximum 15%, usually lower, and only on very small local communities that had a high exposure during spring, it is higher. So I think it's still not the time to rely that most of the people actually cannot be infected. On the contrary, most of the people still can be infected. Thank you.
Thank you. I'll give the floor now to Naomi O'Leary. Naomi.
Thank you very much for taking my question. So, given the increased evidence of the key role of shared air in transmitting the virus, shouldn't you include ventilation and the importance of not being in confined spaces in conversation to those distancing and hand hygiene precepts as well? This question is for Dr. Ammon. In addition, given the increasing evidence of enduring things like neurological, organ and lung damage on younger survivors of COVID-19, what picture is now emerging of the medium to long-term impact on population health? And finally, why does the ECDC advise only forward-looking contact tracing, finding out who the contact has passed on the virus to, rather than backward-looking contact tracing to find out where it's being transmitted, given that it's different from country to country in different cultures? And as you said, it's really important that measures are specifically targeted to where it's being spread in each place. Thanks.
Thank you. First, the Commissioner will come in, and then I'll give the floor to the Director.
Very briefly, I want to come in just to say a point, because you mentioned the impact of those who have been through COVID-19. Just to share with you that I had a meeting, an online meeting with the European Association for Chronic Diseases a week ago, because as Health Commissioner, I'm speaking with all the groups of health, patient groups, and in relation to other issues as well, and of course COVID. And it is of concern, and it is also one of my concerns, and I will be taking this up with of course, my colleagues and health ministers, the fact that we are seeing a number of chronic diseases increase because of COVID-19. So COVID-19, really, we need to monitor it at many different levels, and this is something that we have already been alerted to. Thank you.
Director Ammon, you would like to come in as well, I think.
Yes, regarding the ventilation and the air quality, we have already in summer published a document on the influence of air condition, airing indoor spaces, so that we have insisted all along. But it's still the basic measures are the same that I have mentioned before. Now, regarding the long-term impact in terms of health, I believe we haven't seen the full picture yet. So what is done in various clinical settings is to set up cohorts and study groups of people that had COVID to monitor what kind of sequelae, meaning consequence, can be observed, because I don't think we have seen the full picture yet. And regarding the contact tracing, I think it always goes both ways. I mean, the forward-looking is sort of to be prevented by putting contacts, especially high-risk contacts, in quarantine. And so the backward contact tracing is always done in order to find other people that might have been exposed to. Thank you.
Thank you very much. I will now give the floor to Oliver Grimm.
Oops. Hello. Hi. Do you hear me?
Yes, we do. Go ahead.
Do you hear me?
Yes, we do.
Okay, super. Fantastic. Just very brief. Hi, Oliver Grimm with the Austrian newspaper Die Presse. Very briefly. First of all, questions to all, both the Commissioner and Dr. Ammon. Why is there still no European-wide tracing app in your personal assessment? Secondly, why are there no European-wide testing capacities at all the big major airports, also in your personal experience? And thirdly, why do not all member states provide you with all the necessary data about the spread of the disease? I'm referring, for example, to the very good graph in your document, I think on page 4 or 5, that shows you the age curve. And you can see that I think only half of member states have actually provided these data, which are, I think, quite easily collected. Thank you.
I'll touch a little bit on the mobile apps, on the tracing apps. We all know that contact tracing plays a very important role in phases of the crisis management and in breaking the lines of transmission of this virus. And most member states have decided to launch mobile apps, and a number of them have already done so, not all. And in order to facilitate cross-border exchange of the information, the Commission will be hosting an interoperability gateway at the end of this month, at the beginning of next month, in order to health. So we are aware of this. And I'll let Andrea answer the issue to do with testing, saying that I'll let Andrea take that up and then I'll come back.
Director Ammon, please go ahead.
Yes, thank you. Regarding the apps, as the Commissioner said, many countries have put apps in place. We are now in a process of getting the information from these countries how these apps worked, and there are different issues in particular in terms of the percentage of the population that is actually downloading it, which has different reasons. So we would like to put all these experiences together to see what we can learn from it, because you also have to consider this is the first time that this technology has been used so widely, and you can't expect that it works 100% perfect. So we have to now take the experience and develop it further. Regarding the airports, I think this is again, it's measures that countries have to put in place, and reporting of the countries. We are constantly really in contact with our colleagues that do the reporting to see where their obstacles are to forward the information to us.
Thank you very much. I will take the last question. Journalists, I hear you. I see that there is a general interest in raising a question about Spain. So, Natalia, I think you wanted to raise that question with the support of your colleague journalists. Go ahead.
Hello, do you hear me?
We hear you, yes. We hear you.
Okay, good. Yes, thanks that we finally can ask on Spain, which is the country that is most affected by these new outbreaks. So basically, I wanted to know if the Commission and the ECDC has any specific recommendations for Spain. I mean, like, you made a full range of options for countries like to try to stop the outbreaks, and in Spain, more or less they are doing what you are saying, but still there are a lot of cases and still spiking. So what is your specific recommendation to Spain, and if you are worried about the situation there?
Does Andrea want to take that more, please?
Yes. Andrea, please go ahead. Sorry.
Yes, thank you. I mean, we are normally not commenting on what countries do. So my recommendation is in the same way. We are in contact with Spanish colleagues and see also where we can support them. In principle, they are following up on these still localized outbreaks that they're seeing and implementing the measures. What we are seeing in many countries is that, and that's not only in Spain, that a lot of the transmission that's ongoing right now is due to private meetings, festivities, big family dinners, weddings, all the conventions that you have in with your friends and family, and that is what in many countries is actually driving the epidemiological picture. So we are in contact with the countries to see how we can support them.
Thank you very much. I said it was the last question, but I lied, sorry. There's still really the one very, very, very last for Sarantis. Sarantis, go ahead. Sarantis, do you hear us?
Can you hear me?
Yes, we hear you.
Now you can
ahead.
hear me. Yes. It's a very quick question for Commissioner Kyriakides. In Greece, we see videos of some politicians kissing hands of priests or not wearing masks. Do you believe this is a consistent political message? Have you spoken to national politicians across Europe to send consistent messages, especially when it comes to this matter? Thanks.
I speak with the ministers of health across Europe on an extremely frequent basis from day one of this pandemic, which was in January, February. We're in very close contact. And I think the messages of what we need to be doing in a pandemic and the measures we as citizens need to be taking are not specific to what job we do or where we are. I think that these are measures that go across the board. So we are in very close contact with all the ministers. At the political level, the messages are very clear. I just wanted to be, in ending, I just wanted to highlight one or two points which I feel are important. And I want to thank you for your presence and your interest today. And really thank also the agency for the very strong information coming out. But I wanted to highlight something. My responsibility as Commissioner for Health and Food Safety is to remain vigilant, and this is what we have been doing throughout the last 8 or 9 months. And although I understand that some of you may consider the fact that our messages today may have been a little bit pessimistic, I would call them that our messages are being proactive. Our responsibility is to coordinate and collaborate with member states, and this is what we're doing, and to send clear messages to member states as well. And I would urge to ask member states to consider what we have put into place after working with them from the beginning for joint procurements for ventilators, for joint procurements for laboratory equipment, for personal protective equipment, for therapeutics. These are there available. The Commission has come forward with these, and these now need to be considered in the way to go forward. What we want to avoid, and this is why we are standing before you today, is to a repeat of what we had last spring and avoid generalized lockdowns. And we're standing here today to raise these, in a sense, alarm bells in a proactive way. And I think that we can do this, and we can move forward with this way and be very effective. This is a time when we need each to show a collective and personal responsibility, and we as a Commission are doing everything possible to ensure that the Member States are supported in a very difficult time for themselves and for each and every citizen, not only in Europe but globally. Thank you.
Thank you very much, Commissioner. Thank you very much, Director. Thank you very much to you, colleagues. I understand there's lots of questions. This is a topic that clearly is of interest to you. Naomi suggested to have more regular briefings from the ECDC. We'll definitely see how we can organize things to make sure that we have a good information flow and that we can deal with your questions. But for now, I have to stop the current press conference. We will switch to the press midday briefing. So again, thank you very much. Stay healthy and see you at the midday briefing. Bye.